The American Society of Regional Anesthesia and Pain Medicine was founded in 1975. However, there was an earlier ASRA founded in 1923 by Dr. Louis Gaston Labat and colleagues. Dr. Labat has been called the father of regional anesthesia and pain medicine in the United States. Dr. Labat was born in 1876 in the Seychelles Islands on the east coast of East Africa. He grew up in Mauritius and attended the Royal College Mauritius, graduating with honors in 1894. He went on to study medicine with French surgery professor Victor Pachet. Together, along with Paul Sordat, they wrote the essential regional anesthesia text, published in 1921. Local and regional anesthesia were in their infancy, but becoming important fields of study at this time, as were developments in the understandings of pain. At the time that Labat was studying in Europe, Drs. Charles H. and William J. Mayo were developing the first private multidisciplinary group in Rochester, Minnesota. During a visit to Paris in 1920, Dr. Charles Mayo met Gaston Labat. Mayo was so impressed with his skills that he invited him to come to Rochester and teach surgeons about regional anesthesia. While at Mayo Clinic, Labat wrote Regional Anesthesia, Its Technique and Clinical, which was published in 1922. Discovering new applications for analgesics, Labat advanced the field significantly during this time. As interest grew, the American Society of Regional Anesthesia was founded. Membership in the society was invited for a cost of $5. Dr. William Mayo was invited as an honorary member. ASRA annual meetings included the biggest topics and experts from the day, as well as clinics at various New York area hospitals. The field grew rapidly during the 1920s and 30s as new developments, techniques, and medications came to market. Dr. Labat died in 1934. ASRA remained an active organization after his death. But then World War II came along. Many doctors were called into service at this time. In the war, new discoveries were made, and more doctors learned about anesthesia techniques. Membership dwindled during the war. By 1940, ASRA disbanded. Its remaining funds were donated to the American Society of Anesthesiologists. Meanwhile, ASA's membership expanded significantly as physicians learned about pain and anesthesia during their military service. Those who returned from war and wanted to continue working in the field found many opportunities for education, research, and leadership in the ASA. Understandings of anesthesia advanced significantly, based in part on what was learned during the war. Research and scholarly activity in pain management continued to evolve as well. Over time, however, ASA did not completely fulfill the needs of those interested in the exciting advancements happening in regional anesthesia. These clinicians were discovering new techniques that particularly help specific groups of patients to be able to receive procedures that might otherwise be very challenging, such as the elderly and children, among others. The need for a new version of ASRA re-emerged, leading to the current-day American Society of Regional Anesthesia and Pain Medicine. Discoveries and dissemination of techniques blossomed. In the 1990s, ultrasound-guided regional anesthesia began to emerge. This coincided with many new surgical treatments, enabling reduced hospital stays and faster return to normal function. Today, ASRA Pain Medicine is an interdisciplinary member community serving more than 9,000 healthcare providers, including more than 5,000 members on 6 continents. Although the current ASRA Pain Medicine is only 48 years old, it has been said that the current society would not have existed quite like it does without the work of Dr. Labat and the original ASRA. Today, ASRA Pain Medicine provides education, research, and advocacy for all healthcare providers who care for patients throughout the entire pain continuum. Join us as we celebrate 100 years of excellence in regional anesthesia. Learn about the history of the field. Share your memorabilia from the past on social media using hashtag ASRA100 and contribute artifacts, past documents, and photos to the ASRA Pain Medicine archives. Spread the word